Baltimore-Child-Abuse-Center was created after community leaders saw the additional trauma caused by needless overlap in services created by individual agencies conducting their own work. Altogether, we save over $1,000 per child per investigation. From our humble beginnings, we're now able to provide long-term support for children, as well as be a community watchdog to ensure that child sexual abuse is addressed. "90% of child sexual abuse is committed by someone the child knows." Our community is just beginning to awaken and realize that we can make a difference when it comes to preventing these terrible crimes. Much like sexual assault and domestic violence in the last 20 years, leaders and parents are now looking for solutions to respond to and prevent child sexual abuse. BCAC strives to further that conversation. We believe that abuse can be prevented by public awareness, but not every school, summer camp, or youth program has the funds to pay for such risk management. Through your support, we can make sure that more children will be safer within the programs and institutions that supervise them. BCAC's success comes from our multidisciplinary approach to addressing child trauma, providing a 36% cost savings over traditional methods. We're uniquely positioned to be able to bring together the best of all who work to protect children to ensure that each victim receives the help and justice that every child deserves. Abuse isn't just reported on a typical 9 to 5, Monday to Friday schedule, but also overnight, on holidays, and on weekends. For these families, any occurrence is an emergency, and no child should have to wait until the next available appointment on the next business day to say what happened. As a result, BCAC provides one of the only 24-hour services of its kind in the nation. Law enforcement, social services, and most importantly, families and victims greatly appreciate the fact that they can get answers and help right when they need it. The longer it takes for a child to tell a professional what happened to them, the more likely it is that someone encourages a child to change their story, or a child gets scared and won't tell, or a family just gives up. If that occurs, then we've all let the child down. BCAC measures its success by ensuring all cases come to the center no longer than 72 hours after a report, and by tracking how many children disclose what happened to them. Because our process works, we can get an answer in 85% of cases, thus eliminating confusion, false accusations, and providing the quickest help possible. Do you know what the #1 barrier is to successful treatment at BCAC? Getting a ride. The simple act of providing a taxi ride for our clients enables them to make it to BCAC, to get interviewed and examined, or to accomplish mental health treatment. Without BCAC providing for transportation for over 800 families a year, those children would never get help. Mass transit in Baltimore doesn't effectively get victims to where assistance is available. But by spending over $15,000 annually to provide a ride, we can make sure each child gets help. The scandal at Penn State University provided many lessons, which motivated BCAC's launch of its signature trainings and workshops. We work with staff and leadership at youth-serving organizations, such as schools, religious institutions, and summer camps, on how to protect themselves from the failure to report abuse and keep children safe. Each year, BCAC trains over 1,000 professionals in how to recognize, respond, and report child abuse when discovered. The post-test results from these sessions indicate consistent increase in participant knowledge, letting our team know that we've done our job and prevented an incident of future abuse. Child sexual abuse is a difficult subject for many to discuss. It is a crime of secrecy that has thrived, preying upon the guilt and shame of its victims for many years. Yet the #1 way to defeat this is through public awareness and prevention. BCAC works hard to overcome the shame of silence and get this issue to the forefront of legislative discussions, neighborhood concern, school system interest, and social awareness. While many of us understand that child sexual abuse is a terrible issue, not many know how to respond to it. BCAC helps professionals and adults know their responsibilities and encourage all to report abuse. With additional resources, BCAC would be able to provide all abused children who need mental health support access to therapy through free counseling and transportation to get there. While we have the funds to ensure crisis exams occur, having adequate resources for the lengthy follow-up is a challenge. We would also make sure that every child receives a medical evaluation and the appropriate follow-up referrals. We believe we can do an even better job informing parents and organizations how they can minimize their risk of abuse in their home, school, or community. We need to fill the gap in mandated reporter trainings for teachers, counselors, and other youth workers, so that when abuse is suspected, it's reported, and that those mandated reporters can do a better job preventing abuse.